Hello, everyone. You're very welcome. My name is Margaret Keane, and I am the Education Training and Development Officer here at Midwest ARIES. And for those of you who aren't familiar with what we do, we are the Recovery Education Service here based in HSE Midwest. So locally we cover Limerick, Clare and North Tipperary, but you may have discovered it as an Eventbrite, so you could be living anywhere in the country or even internationally. Thanks for joining us today. And wherever it is where you are, I hope the sun is shining. A little bit of sun here, but yeah, we could do with a bit more. So what are we going to do today? Well, we are, as you said, we're having our webinar. This is our monthly webinar that we run in partnership with Mental Health Ireland. And I just want to say a huge thank you to the team over Mental Health Ireland for all their support in providing the platform, excuse me. So we'll be here for about an hour, and the topic that we're looking at today is recovering together, family recovery in mental health. And even before we came on, I was just having a quick discussion with the panelists, and this is a topic that's close to all of our hearts. So we're really looking forward to how the discussion goes. Now, as always, if you've been to one of our webinars before, we like to encourage engagement right from the get-go. So if you have questions to put to our panelists, and I'll introduce them in a moment, you can put them in through the Q&A. That should be down there on wherever it is on your screen, it's down at the bottom there. Just put in your Q&A and I'll monitor that. And it might even be a comment, it doesn't have to be an actual question. I will do my absolute utmost to get through as many as we can. But bear with us because we do have a lot to get through, and there's certain items we definitely want to discuss. So here for about an hour, it is recorded, and you will get a copy of the link to the recording after the webinar is finished, probably tomorrow at this stage. And we also have it on our podcast, the Wellness Panel, as well. So it's a long form podcast that you can share with friends or anybody you feel that might benefit to listening to this webinar. So I think I've covered everything. So rather than me chatting on here, let's just get on with it. And I'd ask the panelists if they would to open their videos or share their videos so I can introduce them. Lovely to see you, and thank you so much. I'll get them just to introduce themselves in a little bit, but I just want to go through my list here. Now, my head will be bouncing up and down here because I've got my notes. So I just want to go left to right, and we start with the lovely Gina, Gina Delaney. And Gina is one of our colleagues from Mental Health Ireland. She is the Mental Health Ireland Development Officer for the South East region. Now, some of you may know Gina. She was top of our list, I have to say, and that's no offense to Martina and Lorraine, who's always on our panel, but she was top of our list to come along today because Gina has a wealth of experience and also passion for this subject. She is one of the primary, I think, advocates of family recovery nationally. So I'm delighted Gina can join us today. We also have Mike O'Neill. Mike, our leader here, our fearless leader in Midwest ARIES. Mike is just a fantastic supporter of these webinars as well. I think he's been to every single one, but just comes again from a recovery education perspective, but again has a wealth of experience in mental health. Finally, for the moment, but hopefully we'll have our fourth panelist join us shortly. We have Martina Kilcommins, and Martina is the Senior Social Work Practitioner of the East Clare Mental Health Services, and Martina has just been an absolutely fantastic supporter of ARIES right from the get-go. She is a volunteer staff facilitator with us, and again has that experience in terms of the community of supporting families, so has that perspective. And we're delighted, Martina, that you can be here because I know everybody in the HSE is very busy at the minute, so making time for us it's really kind of you today. Our fourth member, and we're hoping that you'll still be able to make it, is Lorraine Naughton, who is the Assistant Director of Nursing in the Acute Psychiatric Unit in UHL. But as we know, things happen in terms of when people can make it or not. So look, we'd hope we'd get Lorraine in later on. But if not, we'd keep going. So with that in mind, let's just start with that round of introductions. So I'm going to start with you, Mike, because I think I always start with you, and I think it would be bad luck if I didn't. Um, uh, can you tell us all just a little bit about your role and particularly your interest in the area of family recovery?
Yeah, thanks, Margaret. And yeah, my name is Mike O'Neill. I'm the manager of the Recovery Education Service. And yeah, some of us have the family interest as well as our own personal interest of recovery as well. And I suppose what's important for us here in ARIES is we always talk about our stakeholders in co-production. And I think this was a fantastic opportunity this month to provide a suite of opportunities and a range of offerings across the month of October. And this fits nicely here. And it's a way of honouring the input, not just the support that we've had here in the service, but also to have, I suppose, even this as a resource going forward that will be recorded and shared and available for people. And I think it's just important we're all equal stakeholders in whether we're staff members, community partners, family members, and the people who use our service. So I think this is yeah, it's a nice conversation to have here today. Thanks, Margaret.
Thanks, Mike, and thanks also for just letting everybody know about this month-long series of events focusing on family recovery that we're having at ARIES. It's been really important. Again, it's something we've wanted to do for a while, and we just got on with it this week, this month, and we've had a great response to it. So thanks for that. Gina, I'll come to you next. So again, just your role and your interest in the area.
Thank you. Thanks, Margaret. Yeah, so I'm Gina Delaney, I'm Development Officer with Mental Health Ireland, covering the Southeast. And I have a particular, I suppose, interest around the family and family recovery. And it fits well with our strategy in Mental Health Ireland then as well, because I suppose, you know, we recognise and I think, you know, more and more we're recognising not just as an organisation, but in Ireland and beyond that, you know, no person is an island. You know, we exist in social circumstances. And then I suppose personally in my own life, I grew up in a single parent home, and my mother had a diagnosis. I'm not you know, what would you say? I don't really like getting hung up on medical terminology or on labels or things, but sometimes I think when you're talking, it can be helpful. So she had a diagnosis of schizophrenia, and I suppose she was a single parent. So that brought its own challenges for us as a family, for me as a child growing up. Yeah, so I suppose that's where my passion and drive would come from. And then I suppose I live with my own mental health challenges. And then more currently, I would have other, I suppose, family experiences around mental health difficulties, but I won't open up about those today. Yeah, thanks.
And thanks, Gina, and thanks for sharing, you know, your personal story in terms of your mom. That's really appreciate that, because I'm sure there's people listening in, where that really resonates with. But yeah, thank you for that. And it's just a joy to have you here, Gina, as usual. Martina, I'll just come to you next. So the same question to you.
Okay, hello everyone. So I'm Martina Kilcommins, and I'm really delighted to be here on the webinar, and delighted to be asked. I suppose I'm a senior social work practitioner within adult mental health services, and as a social worker, I will be always interested in working with the person in their context. So like Gina said, no person is an island, and I will be a strong believer of that. I'm not an island myself. I grew up in a family. I'm really interested in mental health. I've 25 years of working in mental health, so I'm interested in mental health. I'm interested in recovery, but I'm particularly interested in family recovery as well. I suppose I think we can all identify being in a family when someone is sick, whether that's a mental health challenge or a physical health challenge. And when somebody is sick, the ripple effect it has on everybody. It just throws all your routines out of the way, your interests, your hobbies. So I am very aware that a mental health challenge is more than just the person who has the challenge. It impacts on everyone. So any support that can be offered to families and for families' own recovery, I'm really behind that. And as a person in the service, I'll do my best to champion that we really see the family as well as the individual person who's attending the service. So I'm happy to be here.
And thanks, Martina. And I love that, because it's true. That's from our experience. You truly are a champion. I think what we have here today are champions of family recovery, and it's what's needed, particularly, you know, in the healthcare setting. You know, you must come across families every day. And again, bringing up that point of when somebody's physically ill, it's almost more acceptable. You know, you can deal with that, even the stresses of that. But when it comes to mental health challenges, that's a whole different ball game. stigma, unconscious bias, all of those things come into play, and we'll get to that. Right. Okay, let's get to the meat, because and again, we spoke about this as a, you know, as a group was just before we came on, and that term family recovery. I think some people, you know, what is it? What is that? You know, so what does the term? And I'm going to come to each of you. What does the term family recovery and mental health mean to you, and how does it differ, if it does, from personal recovery? So the person recovering from a mental health challenge. So who'd like to come in first? But I will be coming to Ollie on this one.
Yeah, I'll go
Mike.
first. Yeah. And I suppose when you look at family recovery, well, what are you recovering from? You know, and that's the simple question. And as one member of our team in ARIES describes, when we look at, you know, how it impacts on a family when somebody receives or is mentally unwell or receives a diagnosis, or what that looks like in a family, they describe it as it's like a dirty bomb that goes off in the household. And that, for me, sums it up. I think it's the perfect description, because there's the fallout, there's the implications, there's the dealing with the crisis, you know, the impact, the loss, you know. And as I would say, sometimes, you know, when we look at people's recovery, you know, the more you become aware of the losses, then there's perpetual grieving, as I would call, in all of that. You look at if it's a parent in a family home, then children's needs aren't being met. You know, when we look at Maslow's hierarchy of needs, and the basic needs for love, affection, feeling safe, stability, food on the table, you know, so on a very basic level, it can have major implications and be hugely destructive, you know, across the family. Yeah, and I suppose I'm looking into, I suppose, when we, you know, probably talk about our experience of working with people, but I hold fire on that there, because again, just to be able to share some of what it looks like in different families. But yeah, so it's a really interesting topic, this, and I think it's a way of honouring those family members who, you know, who are at the forefront of support, carrying the can, but also living with the consequences of it. So how do you recover from those negative impacts? Yeah. Thanks, Margaret.
And thanks, Mike. And thanks for that. That was a really good description. And what I'm getting from that is that idea of generational trauma, that it's kind of coming through the family, and how how it impacts. Martina, I might come to you next. So in terms of family recovery and mental health, what does it mean? And you know, the key differences, if any, between that and something like personal recovery.
Like, I suppose what I'm thinking, when I'm thinking of family recovery, I'm thinking of a load of individuals, or maybe 2 or 3 individuals in a family. And I suppose I think it's different for everybody. One size doesn't fit all. And it can be hard because we're not on the same journey. And I suppose I can be thinking of lots of different families I'm working with. And sometimes the journey that maybe their loved one is taken, it's very hard for the family member to watch it when maybe they're not taking the help, or they're on it in a different place. But it's about supporting that family member with their own recovery, even in spite of maybe their loved one not being on the same page or in a different place. It's about respecting, I suppose, difference, and kind of working at the pace of the individual family member, and not thinking one size fits all. So yeah, so lots, and it's complex. I don't think it's straightforward, and it's sometimes, it's not that you're recovering and there you go, and it's kind of back and forth. It's kind of like that. It could be 3 steps back, 2 forward. It's a bit like that, but just, I think, having somebody standing alongside you and supporting you in your own recovery journey, not telling you what you should be doing. It's about you finding those things for yourself and getting support around it. So yeah, thanks.
And thanks, Martina. And I suppose just in terms of what you mentioned there, in terms of the, you know, it's not linear, that recovery piece, and that certainly matches with personal recovery anyway. And just one word that popped into my mind when I was listening to you, and it's this idea of a family member somehow as being a bystander. They're not. They're really involved in it, and when they're viewed as a bystander, that I think can do more damage, you know, because they're outside of that, and it's that like lack of control, or, but thank you, Martina, absolutely. Gina, I'll come to you next.
Thanks. Yeah. just suppose it struck me when you said that, like, you know, that sometimes can be like a bystander, like, you know, on like, I suppose, you know, we're all learning more about like how does personal kind of growth and development happen. And I think authenticity is the word that shines through. And like when you become more authentically yourself, that's when you are most happy, and that, you know, that you feel that you're kind of at one inside, like, you know, and that for me happened when I realized that it wasn't only my mother's experience, it was my experience as well, that I was living this. I was experiencing it differently, but I was also living it. It was my experience. And as a result, I had the right to, you know, to step into that and to need to heal and to need to talk and to need to, you know, I suppose express it, because it was my experience. It was a different experience. I was experiencing it differently, but it was my experience and I was impacted. And I suppose, yeah, like taking part in different groups where I felt validated and heard and accepted for that really helped. So I suppose, I think sometimes the definition can help. So there's a definition in the mental health and family caring booklet. And it says recovery is individual and personal based on what you decide is important for yourself. And this can be applied to the family also. So then I suppose if you just, you know, if you replace I and me with us and we, then you turn personal recovery into family recovery.
And that's it, Gina. Thank you for that. That's brilliant. And again, what came out of that for me was, because I think lots of family members struggle with that right to feel that this is impacting on me, because the focus is, and obviously some of the focus must be on the person you're trying to support them, but equally that acknowledgement of that impact and that right to feel this is, you know, this is impacting me. Thanks for sharing that. Just going to put a quick pause in the moment just to welcome Lorraine Naughton. I don't know, Lorraine, if you can hear me there. If you just want to say hello, this is, and Lorraine, thanks for making it, because I know you are incredibly busy. This is Lorraine Naughton. As I said, she's the Assistant Director of Nursing in the Acute Psychiatric Unit in UHL, and we're delighted to have Lorraine. I know. Thank you for making it, Lorraine. I really, really appreciate it. I'm just going to go back to you in just a little bit. I just want to get an idea of family recovery and mental health. What does it mean to you? And then we'll go back into that chat earlier. Also, anybody who's got any questions, please start it in the Q&A. We'd love to hear from you.
Hi everyone. My sincere apologies about being late. Me and IT are frenemies, shall we say? Anyway, I suppose the family piece for me all the time. Like again, I work in the acute unit. I've been there 20 odd years, and I suppose I've seen it from that initial presentation and the enduring, I suppose, experience of mental illness. And for families, I think it's the complexity of it is underestimated from the point of view of, I suppose, Mike spoke to it earlier, the almost trauma of the person themselves having maybe this illness or experience with mental health services or mental health struggles, and then the experience of the wider family as a unit. And they have to deal with that as a family unit. So on a very personal level within, you know, their own family construct. The wider, obviously, you know, we all live in small communities, be they a city one or a rural one, you know, you have the impact of that. And then I think there's the experience for the family of the service and the medical model and the, I suppose, I think, and Margaret used the word about the unconscious bias, I think the unconscious expectation of what you should now just tolerate because someone has been given this diagnosis or this experience, and sure, look, this is the system, and it's very alienating for people, and I can only imagine how frightening it is. And I think there's a piece that we've missed for a long time, and it's only again through people work like yourselves and Gina's work at Martina, we see it, and everybody that's committed to the recovery process for things, that family needs huge support. Every member of the family and the family unit and the person within their family, their identity and everything else. So long-winded answer around. Sorry.
No, not at all. And I think
I suppose.
No, and Lorraine, I think it's really important for family members to hear that from staff, particularly in somewhere like the acute psychiatric unit, that like you have a place here, it's complex. And again, just as an aside, both Martina and Lorraine have been heavily involved with ourselves in terms of resources for family recovery. In particular, Martina has facilitated our understanding, the live version of our Understanding Acute Mental Health Services, Family Carers and Supporters, that covers everything, everything that we can viably in the 2 or 3 hours around admissions to acute psychiatric units. And Lorraine has been just an inspiration for us in terms of our online self-paced course version of that, and actually facilitated us going into the acute unit and filming videos that introduced all the staff members right across the board to family members, again trying to reduce that level of stress and to give that understanding of what happens in that area. So I think we've got an amazing panel here, fully, that covers all bases: community, acute, advocacy, lived experience, and yeah, thank you for that. Now I'm in awe of all of you, but I'll have to stop now. So I'm going to come to there is a question that I'm going to have a look at in a minute, and thank you so much. But I just want to go specifically at the minute to Gina and Mike. And this goes to that lived experience piece. So in your experience, how does supporting a family member experiencing mental health challenges or enduring mental health illness impact on the family? And Lorraine was talking there in terms of, as individuals and as a unit, because again, as Martina said, everybody's experiencing it in different ways. I think Mike might have mentioned that as well. So Mike, you want to come in there?
Yeah, and I suppose just backing up the truck there, and I remember, back in 2018, and again when I was going out meeting stakeholders when I started in this role, and it was probably the first meeting I had with Lorraine out in the acute psychiatric unit, and asking the question, how many new admissions a year, just in one unit? And Lorraine said, we have about 300 first-time new admissions every year. And that has sat with me to this day, that you have 300 families trying to navigate their way around the service, as Lorraine just highlighted there, but also trying to come to terms, acceptance, dealing with stigma, internal stigma in families itself, where other people, family members can reject each other, and then what do I do? Like, and it is that almost panic thing, so, and also very much what you would see, how do families navigate it, and particularly in the adult world of, where you have one adult and they're not maybe adhering to treatment or medication. And I've often heard, speaking with family members where they're on the roller coaster ride. Oh, thank God they're doing okay, and they're doing okay. And then the person suddenly is crashing, and they are crashing with them, and they're following the lead. And every person who I have met who would have described that, they would have spoke out where they reached a point where they had to step back, and that I am independent and I need to be the one with the stable baseline here. That someone needs to take charge. But there's massive learning for family members in this. I remember talking to a mother one time who had an adult daughter who was admitted to hospital in Limerick, and so, but she came in, trying to take care of for, months afterwards, doing everything, trying to take care of that person, and then in a phone call with one of her other daughters, she says, how come you never visit anymore? And she says, well, I have my needs too. And every time I come to the house, all I'm listening to is yada, 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 for the want of a better phrase. But it's the other person who is in crisis and in need and everything else. What about my needs? I need my mother too. And so that, so things can lead to conflict then as well. But I think that thing of, sometimes it needs honest conversations, being open and honest and say how you feel, because we can look at the facts, and the facts are the facts, but feelings is how we respond. And that's where the stress comes in, and how we can manage and, cope and not cope. And I think it's where you have people like in the service, like Lorraine leading on a team where, yeah, it's how do we look after everybody in this? Because, and it's a massive responsibility and it's a big ask, because I know, as Martina said, there's so many individual needs in all of this as well. You know, what makes up that family.
Absolutely, Mike. And that's that, that is it, isn't it? That everybody's responding in different ways to this thing. And I love what you brought up there in terms of, okay, if the focus is all on this one family member, there are other people in that family unit that might need different support, and suddenly they're
And their
all of the
needs are not
focus,
being met.
all the energy, yeah. And how difficult that is, and how, you know, injurious, if that's a word, to that person, you know. And Gina, I'll just get you to follow up on that in terms of
Yeah.
the impact again from your experience, if that's okay.
Yeah, you know, I suppose that expression, well, I definitely don't believe that, you know, nobody wakes up one day with mental health difficulty, isn't it? Like, you know, that there's a process, you know, usually of different things that are happening or have happened, and suppose, you know, kind of compounding on top of each other. And, you know, no more than a person didn't wake up one day with a mental health difficulty, you know, neither did the family members in the same household wake up the same morning knowing how to deal with it or how to live with it. So like, everybody only does their best, and sometimes your best is good enough and sometimes your best is not good enough, but either way you're only doing what you can at the time, isn't it? So you know, sometimes when I do hear things like, you know, well, oftentimes, you know, the family can be causing the problem, like, you know, I feel like responding with a not nice word that I won't use now, and like, but like, obviously, like, you know, when I think about, like, you know, when I was a teenager in particular, like that, like, wow, I was hard to be around. And like, you know, and a lot of that was just simply because I was a teenager, but a lot of it as well because I had two big massive chips, one on each shoulder, and I was just going to fire them at the first person that would, you know, be there, and usually that was my mother, who was dealing with her mental health, you know, and trying as best she could. So, you know, like, I suppose now as an adult, you know, in hindsight, I would have, you know, regret about that, you know, and, you know, wish that I could have managed it differently, but I don't think I could have. You know, I really don't think I could have, without the right supports. I really don't think I could have. And, you know, even then, I suppose, you know, you would have to put a lot of support in. So I would say, you know, each member of the family, you're just doing the best you can with whatever you have available to you at that moment. Sometimes your best is good enough and sometimes it's not good enough, but what can you do anyway? So you just do your best. And sometimes, yeah, you might be adding to it, but that only emphasizes the need for support for family members so that they're doing that bit better. And I just had a couple of other things written down, I suppose, like interrelational issues, like, you know, siblings or, you know, other families, and, you know, it can cause issues there around that. And, you know, developing unhealthy coping mechanisms then yourself, because they're extremely helpful in the moment to help you get through that extremely difficult time. But then they can develop into your default, and then you carry them through, and then you're still accessing them when you really know they're not helping you. And then you have to do all that unlearning and all the rest of it. But yeah, look, there's a load of reasons, but rather than they kind of get compounded into the negativity of all those things, really it just highlights the need for that support, doesn't it? Yeah.
It does. And I think it's that I think you hit on it beautifully there, is that role. Suddenly you might be a sibling, or, you know, a daughter, son, or mother, father, and suddenly you're a caregiver, as opposed to the relationship dynamic has changed. And I can only imagine, particularly, I think that's really important. Again, young people who are put into that role through no fault of their own, and they're trying to work out who they're going to be, and suddenly they're put into that caregiver role. They in particular, I think, need an awful lot of support. But thanks, Mike and Gina, just for like outlining that. I want to go to the Q&As now. Some I might not be able to, we may not be able to answer directly or right now. So I'd ask the panelists if they can look at it with me. First thing I'm going to say is, this is a lovely comment, and I think it speaks to both Lorraine and Martina, and that's: Previously, I felt that services were not very receptive to engaging with family members. I understand it's complex, but services are more open now. Staff reaching out is so welcome as a family member. And sorry, not really a QS, and that's fine. No, it's great, and thank you for that. And I think that's the message here today. I mean, that's why it's really important to have Martina and Lorraine here to say, no, family members are important. Their recovery is equally important, because again, that's impacting on your mental health if you're a family member. Just a couple of other questions there around family counselling. So, and I'm not sure, Martina, if that's one that you can answer directly or in the chat. And that's around family counselling. Does the HSE offer family counselling? I've not been able to find such a service in Galway where I live. I'm told it's not available. And again, we hear this time and again, private therapists have very long waiting lists. Any suggestions? Now you can, if any, Martina, do you want to come in there briefly, or do you want to?
I can come in. Yeah. To the best of my knowledge, there used to be a family therapy service in the Midwest, but that isn't available at the moment. But there is what's called, and I would be one of the facilitators of this, and we have a number of family workers throughout the Midwest, what's called a behavioural family therapy program. Now, it's not in-depth counselling, but it is a program that really looks at, you know, communication, problem solving, and it definitely does support family recovery. The families I've worked with have found it very helpful, but it's more the here and now, dealing with the here and the now and moving forward, as opposed to looking back. And so I don't know if that answers, but I know family therapy isn't available at the moment, family therapy within the HSE.
If there's anything you can share in the chat there, a link or anything, Martina, please do. And if there's anything comes up after the fact post webinar, we'll put it with, you'll be getting a copy of very brief signposting slides, but we'll try and put it in there as well. Martina, thanks for answering that one. The other one I'm just going to go to, and again, if somebody wants to come in on it, or again, just go in the chat, because we do have a couple of things to cover.
I can come in.
Do you want to go on that one?
Yeah.
Do you want to just read that out, Mike, and answer live, please?
And again, I'm only going to give my own personal opinion, and we know what opinions are worth. But what it says here is, how do you deal with not being able to explain what you do in therapy? I find it impossible to tell my wife what I do. It is not that I don't want to talk about it, but I find it excruciating when trying to express all things that take place with dealing with the following: psychologist, psychotherapy, psychiatry. And so the first thing I would have to say is, you don't have to tell anyone. Like that's a relationship between you and your counselor, and that's a safe space. But what you can do is you can thank your wife for being kind, considerate, allowing you to, process stuff that, may be impacting on your relationship. Use phrases maybe like, I expect to come out the end of this process as a better, more complete person, having dealt with my issues, and thank you for allowing me that space to do that. And the payoff for this is, if you stick with me, I'll stick with you, and and we'll be all winners. Because if I was to speak from my experience, say, well, I'll come out the end of this as a better person, and that will enhance our relationship. And I'm doing this to honor us both.
And thanks, Mike, for your honesty there in terms of your experience, because that, I think, does come up from the person who is going through it. Like, what I found is, and again, this comes up in our family recovery workshops, is that, the person experiencing the mental health challenge, sometimes there's guilt there. They know they're going through a lot. They know they're putting a lot of stress on their loved ones, but they're also trying to deal with, being in crisis. And that is always very, very difficult.
And it's very difficult having, but when you're in that place, you only have so much emotional energy as well. So you're not available to your loved one. So again, so it requires great patience and understanding to allow you to exhaust the process. So again, this is a perfect example of family, family recovery and the impact on a family, that everybody is paying a price here, but when we talk about recovery, where we're working towards is we get out the other end of this, shut the door behind us and move on. So Lorraine has her hand up there.
Yeah, I'm just going to go to Lorraine there, Mike. Thanks.
I suppose listening to everyone talking, and you say the I suppose experience for families and the person obviously who is maybe experiencing the mental distress or mental illness, I think and it's amazing. Again, as I say, I'm 20 odd years working, and so now more than ever I see that the piece specifically for the family is happening. And I think so much of that work has to be, like, again, in my own job, meeting the family member, and again, for want of a better word, giving permission to that person to say, my head is done in from them, I'm so sick of them, I'm, you know, and that's okay. That doesn't make you a bad person. It doesn't make you a bad husband, wife, mother, father, sister, brother. That's a normal human condition, whereby today is not a good day or this is not a good hour, and that there's a space, you know, or a forum for someone to be able to say, I'm just at my max now with this. I don't understand what's going on. Because it all, as you say, like even like what Gina was saying around her experience as a teenager, and, you know, her mom, people in family unit are all at different stages of everything. And, you know, the person who's unwell has an experience, the person who's hearing about the unwellness has an experience. And people have to be supported to be able to honestly talk about what that means for them. And I know, Martina, you might support this when you look at like the psychology and stuff of low expressed emotion, high expressed emotion, that again, families are supported to be, there's a normal expectation of behavior that you can have. And there's, you know, again, I'm mindful that my language there now seems probably a bit psychology based or therapy, but what I'm trying to say is that families and the person themselves, and I find that we do this a lot, where we say, you know, when you're going to therapy, that's the space where you don't have to do the editing. You don't have to worry about being polite. You don't have to worry about upsetting somebody, because that's the space for offloading all of that energy. Because the longer we hold on to that distress within ourselves, as I say, it eventually just spills out anyway. And it almost like that self-fulfilling prophecy, isn't it? Of, you know, we're all in it now. We don't know which way we're going, but I do think the work that people are doing around supporting families is crucial, because, as you say, no one is existing in isolation of the family. Even if on that day they're the worst, I hate them all, I don't have anything to do with them. But, you know, that's the dynamic of a family unit. And it's important work, I think, that's going on in that. We need to be committed to that in a very conscious way.
And I think I love that, Lorraine, because I think it's not just in a conscious way, but in a very real way. What you've said there is a very real scenario, you know, and even people, you know, attendees today are listening to that. That's a very powerful message. It's okay to sometimes say, oh, they're wrecking my head, I don't know what to do next. You know, half the time, and Mike will attest to this, just being heard is a huge benefit. You know, I'm not going mad, you know, and this takes me actually to the section where I wanted to land anyway. So thank you for that. And that is that idea of what exactly is it or can be the role of the family member in recovery, particularly either in community mental health or an acute setting, because we know there's issues around confidentiality, information sharing, and that's where the control aspect can be difficult for families, you know, because maybe, you know, they're obviously concerned, they want details, but obviously there are guardrails around that. I come to you, Martina. You might want to follow up on what Lorraine's just said in the context of that question.
Yeah, I mean, okay, coming to the role, I think families can play they play a fundamental role, is what I'd be saying, in supporting a person's recovery and mental health. But you're right, like that can be in many different ways. And I think the information sharing can be, it is both ways. I think the family can really support the staff in supporting the person that their family member, by giving information, but also we as staff can help the family to understand. But yes, there is always maybe the confidentiality is something that's there, and getting the consent for from the person. But I'd always say to family members, sometimes it's when we ask for that consent. It's the timing of talking to the family. It's when is the appropriate time. When somebody comes into hospital first, maybe that's not the immediate time to be looking for the consent. I would always say, if the person who's attending the service saying, no, I don't want my family involved, I would say that that's the start of the conversation as opposed to the end of the conversation. And it's about us as staff teasing that out. What is it about your family? What is it that you don't want to be involved in? It doesn't mean they need to know A to a Z about your treatment and your care plan, but there may be really relevant bits. So it's about working that out together, you know. So it may be very relevant for the family member to hear, you know, and understand what the diagnosis is and what that means, but it's doing it together. So I think it's when somebody says no, it's trying to understand the no and the rationale, but also from a staff member point of view, it's about explaining how it may be helpful for the family to understand. I've worked with many an individual where initially they may have said no, and then yet they're the family members are the people who are finding the huge amount of support. So it's about having that conversation, looking at the reasons being why. If the person continues to say, no, I don't want my family to be involved, and sometimes there's reasons for that, that doesn't mean families can't be given some information. So there is the general information, and certainly family can still link in with us if they have concerns about a person. But even though we can't maybe talk to them about the specifics of the care, we can listen to the family, we can hear their concerns, we can take those concerns into account. And then we can also offer some support and signposting to the family as well. Sometimes even with some of the programs I do, the person who's attending the service may say, I don't want to be involved in the program, but they're very happy for me to offer the program to the family, you know, so, and that can help as well. So I don't know if that answers some of the questions.
No, it does. Yeah. And I know, and I really appreciate that. And again, I think the messaging is really important here, that families here, we have a role, you know, hear that we have a role to play, and just get a little bit of context around that. And now I do want to come back to Mike and Gina shortly, but just while we're in this area, because it's something that comes up again and again in our family recovery workshops, and it's the idea of, and it might not be applicable to everybody who's here today, but it is important, and that's around involuntary admissions. Before I come to that, I just want to say, Mike, got a really nice reply there for you. Thank you very much, Mike, and the panel, for your guidance with my question. I think that was around the what do you say to your loved one or your partner around the counselling issue. So I just want to say thank you, Mike, for that. But yeah, involuntary admission. Look, we know from feedback that that is usually a hugely stressful issue for families, particularly given that it can impact on the long-term relationship between family members and the individual being involuntarily admitted if they've been involved in that process. Can either Lorraine or Martina, I don't know, Lorraine, if you want to take that, just explain the idea of an authorized officer and why that can be used to offset that involvement by the family, and to keep that healing or that relationship together.
Yeah, so again, I suppose under the Mental Health Act, which provides for treatment in an involuntary capacity, basically meaning that somebody, you know, has made a decision in conjunction with somebody. One person's making an application, one person's making a recommendation, usually a general practitioner. But I suppose the piece that you're saying around the authorised officer, an authorised officer is a person who has a background in mental health services. Again, they could have any grade, like social work, nursing, whatever their experience is. And their role would be, they would be called in specifically to meet a person who, be it the initial expressive concern was from the family, it could be from a GP, and they're saying, rather than the family having to make the application, because there's different forms involved in this process, and the first form 1, as you'd hear these words, is the family application. And an awful lot of work, I know, just very quickly, I suppose, from a political agenda and from the Mental Health Act revision that's ongoing, would be the request for that to be removed, that no family member should be put in a position whereby they have to sign a form to make a recommendation that their family member would be put into hospital essentially against their will. It's extremely damaging, and, you know, a lot of families, you know, work through it, and maybe the person, you know, is able to in time say, look, I understand, but it's very difficult for any one person. I mean, I have 2 kids myself, I couldn't conceive of it. So the authorised officer is the person then that will come and do an assessment, be it in the home, be it in the GP surgery, and they're completely then, again, just associated with the services, nothing to do with mum, dad, brother, sister, and they then can make the recommendation that, yes, look, I do agree, Lorraine needs to go to hospital, or in this case, no, she doesn't. And then the follow-on piece from that is the GP involvement. But it's a preferable option, and it's available to anybody. And I think that that's really, really important, that if families are experiencing, you know, maybe somebody who's becoming quite unwell and not willing to engage with services or not willing to meet even the GP, that conversation can happen and go, look, I've heard, or whatever, like that there is a process that doesn't involve us having to make that decision, and every GP will be aware of that as well and can speak to that. And I think it's very important for family to preserve the family
Yeah, it absolutely it is, Lorraine. It's it is, and I know mental health reform have really been pushing that in terms of the new Mental Health Act. I just wanted to bring that in. I'd love to deep more into it. I know, Martina, if you can come in briefly on it, because I do want to move.
I mean, I would echo what Lorraine is saying, and I would be very strong in encouraging families that don't be afraid to ask for the authorised officer. You can ring the community team, or you can ring the acute units if you need to know, I want an authorised officer to really see whether the person I'm worried about needs to come to hospital. And the good thing about the authorised officer, they have additional training, they do a thorough assessment, and it is their job to assess if somebody doesn't need hospital. They'll be the first to say that. So I think that can be really reassuring for the family as well, because they have a gut feeling, but really that this person, then the authorised officer, can go out and can assess, and they might know of other resources that can be put in place to prevent a hospitalisation if that's possible. So
that's great, Martina, and I really appreciate that, because I said it may not be applicable to some of the people here, but I know people listening or watching at a later date, it will be, because it's an important message to get out there. So thank you to both of you. I'm now going to move back to Gina and Mike, and again, it's that lived experience piece, and also from your experience in the mental health services. Look, we know it's stressful. I mean, Gina, you've described there in terms of, supporting your mom, and Mike as well, that dirty bomb idea. So can you get some practical ways for family members to manage their own stress levels and mental health while being a caregiver or a supporter in whatever role they are? And if anybody wants to add anything, put it into the chat there, because it links up. While you're thinking about that, it also links up with a question that we just got in here. So are there organizations that you could recommend? There might be groups that are open for family members, might be like, as people would know, Aware, Shine or Grow. There are so many different groups out there. It can be hard to figure out where to go to keep yourself well as a family member. So can I come to you, Gina, first on that, or Mike, do you want to go first?
Yeah, I'll crack on. I like, I suppose, being able to recommend, or that things that I've tried myself, or that I know somebody who has made the recommendation, because I think that's where there are so many barriers to us actually reaching out or to doing things that we need to do for ourselves. And I think if the recommendation, if it feels like something we could actually get behind, we might be more inclined to actually reach out, so things that I do myself then would be kind of focusing on my own personal healing, personal development, personal growth. And I do that in a range of ways. Unashamedly, I'm a nerd. I buy the books, I join the groups, and I love it. And I love being able to say that, because I think hopefully, if people hear me saying it and other people saying it, that they may do it themselves. Peer support, just invaluable. And that question, I suppose, could tie in with it. There's loads of different groups out there, and you actually named them all in the question, Grow, Aware, Shine, definitely. And they all offer something slightly different. So I would say try them all. Even say, ARIES, that you've dedicated the month of October to family recovery. Dedicate a month to yourself to say, I'm going to try out one a week, try out something. Personally, I settled with Grow for a period of time in my life, and I just found it very helpful. So, I'm happy to share that. Went along to the meetings, got to know the people, shared a cup of tea at the end. Just lovely. Recovery education, linking in with the recovery education services, learning more about yourself and how to cope with different things that come up for you in life. Bit of fun and enjoyment, you just can't beat it. Having a laugh with people, joining a group, whatever it might be. Therapy, my goodness, yeah, definitely. Just going to therapy and having that space, just to, I suppose, just to talk and be yourself. Something that definitely has come up later in life, but has always been there, but I only discovered it. kind of over the last few years that it actually was a big issue, codependency. So codependency, you know, and nothing to be ashamed of. It's something that can happen, you know, especially in as we're younger, you know, that it kind of becomes a way of our personality, of kind of trying to manage our life situations, and it develops into a term called codependency, where we're just really trying to manage what's happening around us and in our lives. And then we end up trying to manage and over-manage and being over-responsible in our lives. So unlearning that has just been really, really liberating. So I suppose, yeah, they're just a few of the different things. There's a couple of resources, I might just pop the links in as well.
Thanks, Gina. And yeah, no, do pop the links in there, and I'll just go through Martina as well. And I want to share that with anybody who's listening as well. I love that idea in terms of like releasing yourself from the codependency piece, because I think a lot of the time family members feel like they have to be the fixers. And really some of that could be, you know, not, you know, it potentially could disempower that person who's recovering as well, because they're on their own journey. It's, you know, so it's I think it's good for both. You know, and that again from my own experience there. I just want to, Michael, come to you in a second, but I just want to mention Martina just put into the chat there. So family counselling options, there's various programs including behavioural family therapy, family talk, parenting programs, including Circle of Security Parenting, and you can check those out, I'm sure, online if you do searches for them. Again, any who's listening, check with your the service or a GP who may be able to signpost you, and social workers are brilliant for that. Whole social work service is just great for that. So Mike, just in terms of yourself, and I cannot believe, geez, this is always the way, you know, there's always so much we want to get through, but again, practical ways or resources or supports that you think that family members can tap into, or even just like personal things they can do for themselves that would help them.
Yeah, thanks, Margaret. And just before I come to that, I suppose just coming back a little bit towards people when they're admitted, and again where they're with confidentiality, you don't want to share something. I suppose this is just it popped into my head a conversation we had here with a senior clinical psychologist, and I asked him, you know, what percentage of people come across your service that have encountered trauma? And he says 99% plus, you know. And then one of our staff members here, I said, what's the worst kind of trauma? She asked him, and the response was, yours. You know, so it's trauma for everyone when this dirty bomb goes off, you know. And when we think about where a family is, like, you know, where they say, I don't want you to tell my family, don't tell them anything confidential. That's a moment in time, because that's what trauma looks like. I don't feel safe. I don't trust anyone. You can't tell them. But as you know, a person becomes, you know, embedded in their care, you know, and their recovery, that will change. You know, and as Martina said, you could get small ins in how to manage that. And I suppose, again, listening to Gina earlier, this is what helps. You know, because particularly in families, when we want to fix, when we can fix, you know, and then we beat ourselves up, you know. And I think, and as much as Gina expressed there, speaking about her mother, with the passage of time, she learned to be more compassionate with herself. Whereas, and as part of that compassion, if I was to say, what do we need to do? We just need to be compassionate with ourselves in supporting somebody else as well. You know, because that self-compassion, we can overlook it, you know, and self-kindness as well, you know, because as I often say it when you know, I don't facilitate as much as I would have liked to now, say, particularly in, you know, in the adult acute units, is that, like, if there was anything easy about recovery, none of us would be here, because it's not easy. You know, it's a difficult road, and it's a difficult experience in this individual to us all. But I think having that little bit of kindness and compassion to ourselves, that little bit of empathy, understanding, yeah, it goes a long way. And timing is everything, you know, as well, particularly, you know, in somebody's recovery. Thanks, Mark.
It is, Mike, and it's so true. And it's also that forgiveness as well, because stuff happens, you know, forgive yourself, forgive, you know, and that's probably the biggest sometime hurdle to get over. But I'll just go back in terms of the Q&A, and thank you so much, guys, for, you know, just engaging with this topic. It is a tricky one. Just got a lovely comment there. Thank you so much for this open discussion. It was so personal and so professional. I would so have needed peer support, but maybe was not ready previously. I can see that things are improving and really appreciate the speakers today. Thank you so much, whoever that was, for putting that in, because I think it's great for staff to hear that, the value of it, you know. So thank you again. We don't have time to go through this, but again, if anybody wants to put this in the chat, any advice or suggestions on how you stop being the fixer or this codependency. And again, Gina, if there's anything that you can send to me that we can send out post the webinar to people, if things come to mind, we'll do that. I'm going to put just actually one more. Do I need to check? No, I'm grand. We're 4 minutes out. I do want to just spend the last couple of minutes just sharing some signposting. Anybody who wants to, any of the panelists who want to share specific resources or just thoughts, please put them into the chat now. I'd really appreciate that. So I'll take you through very quickly and then we'll say our goodbyes. As usual, it's been a very, very quick hour, but as Mike mentioned, yeah, we're having our family recovery month, and we've had events all the way through the month. There's 3 events coming up that you might, you know, for yourself or if your loved one, you know, because all of our workshops, to be honest with you, could be helpful in family recovery. So tomorrow we're looking at creativity for well-being, one of our most popular workshops. And again, it's trying to tap into our creativity to support ourselves. And sometimes you need that distraction, you know, and a reminder that you're a human being in your own right, that you're not that fixer, going back to the codependency piece. And then again, the identity piece, my mental health, exploring my identity. You could go to this workshop, again, it's online, and think about what it means to you be as yourself. Because I think sometimes when you get into that fixer role, you do lose a sense of self because all the focus goes in on trying to be that supporter or caregiver. And then finally, and this is kind of a really important one, I've already mentioned it, but for anybody who I have an interest in that, you might be working in the area, or you might have a family member who has a long-standing mental illness and has been through the acute services. There's Understanding Acute Mental Health Services for Families, Carers and Supporters there on October 30th. All of these can be booked on Eventbrite. Just do a search for Midwest ARIES and you'll find us. I won't go in this in detail, but throughout November, we've got a whole series of recovery workshops online. We are a fully hybrid service, so we also are face-to-face online, and we also have self-paced courses. These are just some of the face-to-face in-person workshops we'll be running in November. We are out in Killaloo, Ballina Community Resource Centre, Family Resource Centre there, and we love family resource centres. We absolutely love them. Shannon Family Resource Centre, Killaloo, Silver Arch, they are the lifeblood of any connections. And my advice would be seek out those family resource centres, because you never know what's going on there that would help you support yourself or your loved one, and provide that really important connection piece. We have then our self-care building, My Resilience Perinatal workshop on 21st of November. It's practically full, but it's specifically for women. The perinatal periods covers conception right through to 12 months postpartum. Doesn't matter if you're first-time mum or whatever you are. It's part of our perinatal self-care program. Again, the message is taking care of me, because a lot of the time it's, you know, it's self-care is seen as selfish, but it's not. It's part of keeping you, you know, well. Again, these are all available, and we'll be sending out copies of these anyway to anybody who attended or signed up. We have the Introducing Occupational Therapy Guide, which is a really great guide that we partnered with Occupational Therapy with, just explaining what it is and how it can help. We have the self-paced version where you'd get to go through the doors and meet Lorraine and the fabulous team there. They really are just compassionate people in the acute unit there in UHL, and that's available 24/7. And again, we have the My Perinatal Self-Care Workbook. We've got a companion course, and then we have an audio book there as well. So all of these will go out with you. So again, you can access them from the links that we send out. Our next webinar is on November 27th, and look, it's the C word, lads. I'm sorry. I apologize. But it's my mental health looking after me at Christmas, a really important one, because, Christmas is, yeah, it's lovely, but it's also very, very stressful and brings a lot of emotions up for a lot of people. So it's an important one that we run. Now, Martina, I'm going to very quickly pass it on to you because this is really important and we'd like to get your help.
Okay. So this is, and I know there is a link there, it's actually a survey, and it's a piece of research that a number of us here in Clare are doing with Mary I College in Limerick, but it's a nationwide survey. It's really looking for parents' voices, parents living with a mental health challenge. We want to hear about your experiences. We want to hear about what supports are good, what's not working, how we can improve services going forward. So I suppose if you scan the link is in there, and there is a poster, and I think Margaret, you are putting it up on your ARIES website as well. So anyone who feel they may have something to contribute, I'd encourage you to fill in the survey and give us food for thought, please.
Sorry, I was locked out of my audio there. Yeah, thanks. If you can do, because this is how we learn, this is how the service learns, this is how we improve service for everybody. And well done to Martina for, spearheading that. It's just brilliant. This is obviously Mental Health Ireland. This is the contact there, Clare Flynn, who's the development officer there in the Midwest, if you need to reach out to Clare. And you can find us online. We are everywhere on all of the socials, Facebook, Twitter, and Instagram. We're at Midwest ARIES, and we try to update that as much as we can without it interfering with our own mental health. Let's face it. But what's great is one thing that we love doing is having our podcasts, and this webinar will be available as a long form podcast that you can share with someone that you think it might be helpful for. Go for your walk, put it on your headphones, and away you go. So I think we're 2 minutes over, but I think you'll forgive us. And thank you for those who stayed with us. You were very good. I'll just pass around to everybody for their final thoughts and a goodbye. So I'm just going as I see. So Gina, just want to say, just before we start, Gina, I just want to say there is a feedback form. We live or die by our feedback. Please, if you can, just spend a couple of minutes. It's in the chat area there. Mike is very good. He's put it in there for me. If you could just give us some feedback on how you think we went today. So Gina, do you want us to just say goodbye?
Thanks so much, everyone. Really enjoyed it. Thank you. Take care.
You're muted, Margaret.
It was bound to happen. Thanks, Gina. Brilliant. And thanks for all the resources you've shared as well. Really appreciate it. Mike, goodbyes.
Yeah, goodbye, everyone. And very often, as I would say here, when some people might think that they're not doing enough or I need to do more, and all I always say is never underestimate the power of your presence at home.
Yeah, no, it's so true, Mike. So true. Martina.
Yeah, I just like to say goodbye to everyone. I'm happy to be here. I've learned there's always things to learn. And yes, we're doing something, but we can always do more, is what I'd be saying from a staff perspective anyway. So look, yeah, I'm happy to be here and involved.
And thanks, Martina. Thanks for your time today. And again, great message. And I think Lorraine, probably has to go. I think she might not be. Oh, you're back, Lorraine. Do you want to just say a quick goodbye?
Yeah, literally just thank you to everybody. Thanks always to Margaret and Mike for having me, and to everybody who was listening. I hope there's anything, as I say, Margaret or any of the lads will follow, but I hope you get benefited.
And finally, I just want to say a huge thank you to every single one of the panelists. You've been absolutely brilliant. Just, giving your time, your honesty. What I love about these webinars, as Mike often says, is that we can have a safe conversation. Just thanks for your time, your insight. We really, really appreciate it. So we'll be back here next November 27th. Hope to see you then. And thanks finally to all those who attended today. We really appreciate your comments. You've really helped to keep the conversation flowing, and I hope whatever you do, as Mike said, be kind to yourself and have a good day, and hope to see you online again soon. Take care.